United Way of Central Iowa shifted to a community impact model, United Way, back in 2009, and we centered around goals in education, income, and health. As that work evolved, what we realized was those elements of education, income, and health couldn't exist divorced from each other. There was leverage to be found in bringing all of those together. Because if an individual was suffering from lack of education, couldn't get the job that they needed, those two were integrated, and there might be a health issue in there as well. So it was important to us to find where those gaps were happening between education, income, and health, and figure out a way to leverage those. Our most recent work within integrated funding and integrated work was a project that we did this past year. It was a demonstration project called the HOPE Initiative. And HOPE wasn't just a neat name to call this effort. Research shows that people in poverty don't just suffer from a lack of money. The big issue is they suffer from a lack of hope to move forward. That future orientation is also a large part of why they remain in poverty. So we adopted 25 families, if you will, through our funded partners, and we centered on the individual instead of the various systems that those individuals had to navigate. We are still knee-deep in that process, but the outcomes from that integrated effort already have been very, very fruitful. If other local United Ways are like the United Way of Central Iowa and have adopted these bold goals for their community, an integrated approach we have found is the best way to help meet those broad community goals. It allows for various organizations and cross sectors to get engaged in the work when you're trying to approach the issues holistically and not from a particular vantage point. The other piece that we have found very critical here in Central Iowa is that local United Ways and other organizations have been trying to find a way for them to remain relevant. And one of the things that has helped our local United Way is find out how to be essential. Relevant isn't enough, essential is important. And the value add that we as a local United Way bring through this integrated effort is starting to create a unique space for United Way so that we are the ones that are scanning the community. We are seeing where the peaks are, where the valleys are, and where those crevasses are in those systems so that we can bring the resources to bear collectively. We can convene those to figure out what the best approach is to solve those deep and chronic community issues. What we have found through our integrated efforts is that it creates a unique space for United Way because we are able to see where there are gaps in our community and where there are leverage points in our community. So now we have people coming to us for things that 5 years ago people might say, why is United Way doing that? But today they see us as that kind of community scanner to see what issues are and how we might bring resources to bear. Another thing that we have learned here in Central Iowa that might not be intuitively obvious is that we are gaining efficiencies and effectiveness in how we're funding and partnering with the community. With our HOPE initiative, we had a good amount of resources set aside to execute that initiative, and what we found is we didn't need nearly that many resources because programs we were already funding, we could leverage to serve these families. So we're gaining efficiency, we're gaining effectiveness, we're creating a unique space for ourselves in the community. And this is also work that donors really appreciate. They can get involved, they can see the direct impact of what they're doing and what we're trying to achieve. And that's also giving us great strides to help people understand who we are as United Way. You know, we all say that United Way is well known but not well understood. We're making progress toward people understanding who we are and what role we play in the community because of the integrated funded efforts that we've undertaken. Some of the things that we've